One-on-One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is UPMC Susquehanna President Stephen Johnson, interviewed by reporter Justin Strawsser.
Wishing you could go back to your teens is a nice thought. Wishing you could buy a brand new 2018 car priced in the teens is unheard of. Not at Sunbury Motors Kia.
Wanna see you in a Kia. Sunbury Motors Kia.
It's 20 under 20. 20 vehicles for under 20 grand. Sunbury Motors Kia has 20 new 2018 Kia Rios, Optimas, Souls, and Fortes for under $20,000. Sunbury Motors Kia makes it easy to own a brand new 2018 Kia. 20 under 20. Don't get badgered by other dealers. Sunbury Motors Kia can get you into a 2018 Kia for under 20 grand. You can go back to your teens. Plus, all have Kia's 10-year, 100,000-mile powertrain warranty. And SMC has over 25 certified pre-owned Kias to choose from, too. Sunbury Motors Kia, routes 11 and 15 Hummel's Wharf, and at sunburymotorskia.com.
Offer expires 5/31/18. Warranty is a limited powertrain warranty. For details, see retailer or go to kia.com.
Welcome to One-on-One. I'm Justin Strawsser. Our guest today is Steve Johnson, the president of UPMC Susquehanna. UPM Susquehanna is, of course, the owner of the former Sunbury Community Hospital. They've been the owner since October, now called UPMC Susquehanna Sunbury. Thanks, Steve, for joining us today.
My pleasure. Glad to be here.
Now, this Sunbury Hospital has been a community hospital that's been kind of bounced around for the last decade under several for-profit entities, and UPMC seems to offer a little bit of stability and a little bit of assurance to employees and patients. Does that mean that UPMC is kind of in it for the long haul?
I would certainly draw that conclusion.
Okay.
Our focus at UPMC is really to support neighborhood hospitals or community hospitals. And let me back up maybe and just describe a little bit more about UPMC so it gives you some context of why we feel confident that this is a long-term commitment. UPMC is a $16 billion a year company. They own Pennsylvania's most successful health plan, number one ranked actually by its members for patient and member satisfaction. They're in 12 countries around the United States, or around the world rather, United States being just their headquarters. They're on 4 continents. They're a world-ranked organization. They have the number 3 largest physician residency and fellowship training program in the U.S. They have one of the largest and most well-recognized medical schools in the country, and 80,000 employees. So it gives you some idea of the scale and the mass.
It's one of Pennsylvania's largest, right?
It really is. In fact, they're the largest non-government employer in Pennsylvania for any classification. So they're an organization that has the capacity and the capability, and they also have the commitment to community and a real understanding of how to manage healthcare organizations. And so it does give us all, I think, a considerable degree of confidence about their long-term commitment here.
Okay. Now, Sunbury, and by extension, the former hospital, the former community hospital, has had a bit of a negative stigma in the valley. Has UPMC had to do anything to kind of fight through that or change that perception?
Well, I think if you ask employees today, if you were to make rounds inside the facility, there's a sense of optimism and a sense of hope now today that really didn't exist just a year ago. We acquired the organization last fall, and up to that point, for several years in a row, they had lost about $4 million a year, and were very concerned about the likelihood at that point that they would close. And so, when their parent organization was not making any investments in the facility, they were not hiring any new physicians, the general sense of concern about the future of the organization was rampant throughout the employee family. Now, when you walk through the organization, there's a sense of hope and energy and excitement and confidence that we're in a building mode. We're recovering, if you will, the performance of years ago when the reputation was great, when friends, family, and neighbors wanted to use the facility. We're on that journey now, and we're making good progress so far.
Would you say that was one of your biggest roadblocks, or have there been other bigger roadblocks and challenges here when you come to Sunbury?
Well, the sense of perception is always a challenging issue to try to manage through. And part of the way we address that is by, first of all, making a commitment just to beautify the facility. So if you were to drive by today,
I was over there
it looks
today,
different,
or
feels
a
different.
couple days ago, and saw some of the landscaping happening.
Yeah, so it's, those are minor things, but they send a powerful message to the neighbors and to the staff that work there. We're doing also some facility work inside the buildings. We're looking at expanding parking on the south side of the complex, for example, and kind of changing the entryway around into the building. We're in the process of bringing in some new physicians and starting some new services. All that adds to the excitement and also helps improve the financial performance of the organization.
Now, is that part of the offering new services, or there's more to it?
Well, it is part of. There are two parts to the effort here. We would describe this as a turnaround situation, meaning we have to turn around the economic performance. We have to turn around the community's confidence in the services. We have to turn around employees' self-perception and sense of pride and ownership in the operation. And the way that starts is by first addressing the finances. And step one there is to reduce operating costs wherever it seems appropriate. So during the first 6 months, for example, we've reduced our operating costs by half. During the second 6 months, we'll reduce that by another half. That'll leave about $1 million of annual operating deficit. To address that, we have to grow the programs and services there. So we're actually already preparing to expand services. General surgery is an example. We have a new general surgeon starting in June.
Okay.
We've added occupational health. We've added programs called Healthy Partners, which are designed to help employers in the area with their employee families. So as we grow the organization, we would expect community confidence to grow and the economics to improve along with that.
I was doing a little reading about All of Us. That's the collecting data for research purposes. Can you explain kind of what that partnership is with patients and what it means for patient care?
Well, in today's world of healthcare, the business of precision medicine is really the direction that our industry is going. The science behind that requires that we have a much better understanding of each individual patient, their physiology, their health history, their mental health history, and by having a good, well-rounded understanding of each individual patient, we can customize and design services to help keep them more healthy up front, and then to address any health concerns that they may be challenged with over the course of their life. So what we're doing now is building that database so we have the capability as times and opportunities and needs present to really precisely address the care needs of each individual patient.
Now, that's for everybody? Is that going to be available for people at Sunbury to participate in?
That will eventually be available for everyone.
Okay. Now, talk a little bit about the expansion into the Susquehanna Valley. You have some close ties to Williamsport and Muncie, and now you're right in the middle of a well-established health system with Geisinger and Evangelical. What's the thought process behind UPMC's push here?
Well, UPMC, in operating this large health plan that it currently provides to Pennsylvania, I think about 3.5 million members, just to give you some idea of size, is looking at providing that health plan in areas that it didn't previously have a presence, to give local citizens choice. Give them an opportunity to select a different health insurance company. When they come into a community and start to provide a new health insurance plan, they also need then a family of physician and hospital providers. That's where Sunbury comes in. Sunbury is one of those provider organizational units. They need several of them, but they are providing a wonderful service to those citizens who choose the UPMC health plan. Evangelical Hospital has also signed on as a provider. So you could either be part of the organization like Sunbury is, or you can be contracted with the organization like Evangelical is, and be available to assist delivery of services to those who use the UPMC health plan.
So do you, obviously we have these big health organizations in this area that are taking on some big projects. Evangelical alone has a $75 million expansion coming up here. Do you monitor that as a health system, and does that mean anything, or do you keep the focus internal?
We don't pay a lot of attention to what other health systems are doing.
Okay.
Frankly, our focus is on doing what we do and doing it better than anyone else. And if we do that, we're confident that the community will choose us for their services, and that it will help assure our ability to continue to provide services from a financial perspective as well as from a clinical quality perspective.
Okay. We're going to take a break. We'll be right back with Steve Johnson.
Wishing you could go back to your teens is a nice thought. Wishing you could buy a brand new 2018 car priced in the teens is unheard of. Not at Sunbury Motors Kia.
Wanna see you in a Kia. Sunbury Motors Kia.
It's 20 under 20. 20 vehicles for under 20 grand. Sunbury Motors Kia has 20 new 2018 Kia Rios, Optimas, Souls, and Fortes for under $20,000. Sunbury Motors Kia makes it easy to own a brand new 2018 Kia. 20 under 20. Don't get badgered by other dealers. Sunbury Motors Kia can get you into a 2018 Kia for under 20 grand.
You can go back to your teens.
Plus, all have Kia's 10-year, 100,000-mile powertrain warranty. And SMC has over 25 certified pre-owned Kias to choose from, too. Sunbury Motors Kia, routes 11 and 15 Hummel's Wharf, and at sunburymotorskia.com.
Offer expires 5/31/18. Warranty is a limited powertrain warranty. For details, see retailer or go to kia.com.
We're back with Steve Johnson, the president of UPMC Susquehanna. Before the break, we were talking a little bit about other health systems. A few years ago, Geisinger and Evangelical had talked about what they call co-opetition, which is sort of like cooperation, competition, sort of like that. Is that something that you think will continue to get patients the best care no matter what the facility?
Well, our focus is not on cooperation per se or competition per se. It's on doing the right things for the patients at the right time, every time. And what that often means is we actually refer patients to other organizations if that's the right thing to do at the time. I think there are some opportunities to work together to do a better job on behalf of patients from this region. And I'll give you just one good example. The problem in this region with opioids, actually I should say maybe the problem in this entire country with opioids is extraordinary. More people died last year from opioid-related overdoses than died in the entire Vietnam War. And those who are tracking this problem closely suggest that over this next decade, more people could die, if the problem's unchecked, more people could die than U.S. citizens died in the entire World War II saga.
I hadn't heard that.
It's just, these numbers are just extraordinary. And there's a disproportionate death rate, mortality rate in rural communities. This is not a city problem. This is a rural problem. And so when we think about just the sheer size and magnitude of a problem like this, and the fact that the entire healthcare industry arguably owns some of the responsibility for causing this problem, we also should be working together to resolve the problem. So one of the things that UPMC Susquehanna has done, for example, is reduce the prescriptions by 33%. So we've reduced the number of prescriptions associated with morphine or opioids by 1/3 during this past year. We've actually reduced the morphine equivalent doses by 50%. So we didn't just reduce the number of prescriptions, but up the amounts for everybody. We actually reduced the amounts even further. That's pretty extraordinary work. And it seems to me that it would be ideal to share the successes associated with that with other providers in the region here so that we could then work together and pool our resources to help further address a problem like this. So we've had some discussions about that. We haven't kicked anything off yet officially, but I think there's certainly a need and I think a tremendous opportunity.
Yeah, and this line of business, being a reporter, we see it almost everywhere now. I'm doing a story on grandparents raising their grandchildren, And the leading cause of that right now is because people are addicted, substance abuse, opiate abuse. So do you feel like that the steps that you're taking to review your prescriptions, do you feel like that's the only thing that can be done? Education, do you think that's a part of it too? Providing educating providers and patients.
Yeah, I think it's a great point. There really are three major buckets or three major sets of activities associated with this. What I described is just one. It's the managing of the prescriptions themselves coming from our medical staff. Up front, though, is the education. It's the awareness, the appreciation of how serious the issue, what the issue is doing to us as a society, and what we can do to prevent it. So that whole education piece is enormously important. Important for families, important for school-age children, important, frankly, for providers to really have a good understanding of the impact of prescribing habits. And then the third bucket, if you will, is the issue of managing a patient situation when we've identified an individual that has this problem, and not treating them as second-class citizens, but getting them the help they need through medication assisted treatment facilities, through proper counseling and coaching, working with the single county authorities that are responsible for drug and alcohol abuse and recovery, doing quick handoffs between our emergency and paramedic and pre-hospital personnel and those kinds of caregivers. All that's part of the solution. So it's really three buckets of activities as you've described it.
Is it kind of stressful then for the nurses and the people in there with all these deaths, overdoses coming in? Is there anything for them?
Yeah, it's really painful, and we do have support groups for caregivers, for our physicians and for our nurses and for all of our nurse and physician extenders. Candidly, those support systems extend to what we call all violent situations.
Okay.
We really refer to these overdose situations as a category of violence. There are, unfortunately, other categories of violence, and this is very troubling for our caregiving staff. So supporting them properly with counseling and coaching is part of our responsibility as an employer in the region.
Okay. And what are some of the impacts that UPMC, its affiliates, and patients have seen for changes within the Affordable Health Care Act?
Well, the biggest change, and there are many, but the biggest change that I think would be good to speak to is the change from a provider-based, what we'll call a fee-for-service system. Now, what a fee-for-service system does is reward financially individual physicians and individual hospitals for delivering care. So the more care you deliver, the more financially rewarded you are. So the reinforcement, if you will, the incentive is to provide more care. Whether it's needed or not, it's really secondary. At least from an economic perspective, the motivation is to do more. One of the things that the Affordable Care package brought to the table was a consideration for what we now call population health orientation. Okay. And it's really a focus on doing just what's needed for our patients and finding other outlets of service delivery, prevention, wellness, providing services at home or in a physician office or in a clinic rather than in a hospital to assure that the entire population in a given community gets the right care, but gets it in as reasonable a cost base as it can possibly get it. That's been a huge change, a tsunami effect, in fact, from a business perspective on our industry.
Do hospitals and healthcare systems, do they need that own personal healthcare plan in today's day and age? Well,
we need plans for our own employee service partners. We refer to all of our employees, by the way, as service partners. We have physician service partners and we have employee service partners. We need coverage for them as well.
Right.
One of the things that we've done is we use the UPMC health plan.
Right.
And when we signed up all of our service partners on that plan, it was actually providing better service to each of them, and it did it at a less expensive cost for us as an employer. Good business decision. We think providing that kind of capability and capacity for other employers in the region makes a lot of sense as well. So, one of the areas of focus that's part of that is wellness. So the part of the package is to focus on keeping people healthy and, frankly, using services less often, even for us as a provider.
I understand that UPMC accepts Geisinger's health plan at its facilities, but UPMC's health care is not accepted at Geisinger. Is that something that remains a work in progress to work out a solution?
That does remain a work in progress. Our philosophy is to remain, if I could use this term, insurance agnostic.
Okay.
What we mean by that is as long as we've properly negotiated the business deal points, we'll use any insurance that's available in the region. That's not a practice that's exercised by everyone in our space, which is unfortunate, but that is the true circumstance. And so we remain open and willing, but not preoccupied with what someone else is doing. We're focusing on doing the right things for our patients and the right things for employers and friends and neighbors in our own community, and we'll let the business chips fall where they fall.
Fair enough. Now, last question for you here is you mentioned about Sunbury getting some beautification over there at the facility. What's next for patients here in this region for that and at that facility?
So we have a number of things that we're working through as we speak. The final, I'll share a set of things that we're working on in this first year, but we're going to be continuously monitoring and studying and considering what makes the most sense for the community. What are the biggest, most frequent needs? Those are the things we want to spend our resources on. So as we become more familiar with the community and more familiar with the patients in this community, we'll have a much better sense of that.
Okay.
In the short term, however, we're focusing on general surgery, podiatry, some telehealth services to bring neurology to the emergency room. We're looking at a number of services that we provide today, but adding capacity to those. So it's not so much new services, it is opening up appointment slots so our patients can get easier access, more convenient appointments for the services that are available today.
Okay. All right. Well, that's all the time we have for today. Steve, thanks for joining us, and welcome to the Susquehanna Valley.
It's my pleasure. Thank you very much.
Thank you for watching One on One. We hope you will join us this coming Thursday at noon for a new installment.